Hey, good Saturday afternoon. Hey, I wanted to do a quick video this afternoon. I came across this article at military.com, and the journalist is Russell B. Limley. It's an op-ed. It's just for house cleaning. It says the opinions expressed in this op-ed are those of the author and do not necessarily reflect the views of military.com, nor do they reflect my views. This is an op-ed. Anytime I see something that I think could broaden veterans' awareness, I'm going to share it. So let's get into this. Community care is not VA care. There's a new cliche being parroted at congressional hearings on Veterans Affairs these days. Community care is VA care. Republican policymakers are intimating that private health care provided to veterans through the Veterans Community Care Program, or the VCCP, is equivalent to the services furnished directly by the Veterans Health Administration, which is the VA. After all, their argument goes, if these two options are interchangeable, there's no downside to redirecting funds from the VA to the VCCP. But is community care comparable to VA care? Not by a long shot. If VCC care was the same as VA care, then private care appointment wait times would be publicly transparent, and they're not. Every veteran seeking VCCP care for post-traumatic stress disorder and depression would be offered the option, if desired, of evidence-based psychotherapy, and they're not. Private providers would undergo mandatory training in veteran-specific conditions, for example, in toxic exposure and military culture. They don't. Private providers would conduct annual screenings for suicide, PTSD, substance use, and depression. They don't. Private care would be closely scrutinized and publicly reported by the Inspector General. It isn't. A post-mortem issue brief would be conducted whenever a veteran in private care dies by suicide. It isn't. Private care aggregated quality metric scores would be published on a publicly available website. They aren't. Multiple appointments would be offered on the same day, all in one place through private care, and they aren't. In short, community care doesn't hold a candle to the VA, and it shows. Veterans who receive care at the VCCP instead of VA hospitals face a higher risk of death. Veterans electing coronary procedures at VCCP hospitals experience equivalent or higher 30-day mortality rates compared to VA facilities. Older VA enrolled veterans have higher 30-day mortality rates from stroke and heart failure when treated at non-VA facilities rather than VA hospitals. Veterans receiving VA-paid chronic dialysis in community settings have higher 2-year mortality rates than those treated within the VA system. Duly enrolled veterans over 65 admitted to community hospitals during COVID-19 pandemic had higher 30-day mortality rates than their counterparts in VA medical centers. Even suicide rates are greater among veterans who exclusively use VCCP rather than VA care. The VA's superior outcomes are generally attributed to its higher standards for health care delivery. Broadly speaking, the VA outperforms private sector care on a wide swath of key quality metrics. In the annual Centers for Medical Care and Medicaid Services hospitals ratings, 67% of VA hospitals receive 4 or 5 stars, compared to its 41% of non-VA hospitals. Hang in there, I'm almost done. Before prematurely proclaiming that community care is VA care, policymakers should first heed the advice of a RAND Corporation study that suggests that elected leaders must ensure that standards for community care are at least equal to those of VA delivered care. The debate isn't about whether veterans should have community options. They should, particularly in rural areas where VA facilities may be distant. It's about recognizing that these two systems are not interchangeable and that sustaining full funding for VA care benefits the preponderance of veterans. What's at stake is the long-term sustainability of the VA's workforce and physical infrastructure for veteran-centered care, which cannot be replicated in the private sector. Yet, if the administration follows through on its pledge to slash tens of thousands of jobs, or if the Veteran Access Act that is being deliberated is ratified, billions of dollars will funnel into community care at the expense of needed investments in the VA. Under those circumstances, the slogan "Community Care is VA Care" will indeed become the reality, though not in its implied meaning. Should the VA cut 70,000 employees next year, community care will ultimately be VA care, since it will become the only choice left in many areas. Howling out a system uniquely positioned to address veterans' healthcare needs is the not so veiled intent of many of those uttering this slick platitude. This was Russell B. Limley, Senior Policy Analyst at the Veterans Healthcare Policy. So it's an op-ed. This is what he came up with. I will touch on it. There is a place, because I've used community care quite a bit, so there is a place for it. But me personally, I wouldn't want to have the community care replacing the VA. I kind of, when I'm at community care, I kind of feel a little out of place because they really, they don't speak veterans language, So personally, I would rather stay with the VA, but definitely have access to community care. If there's a way that they can always keep both like that, that's the way I would like to see it. But hey, you got your opinion on it. If you feel that this was beneficial to our veterans, like, share, and comment on it, and we'll discuss it. All right, that's all I got for you guys today. I am out.